Hello friends, I call this sodium potassium pump as CHAMP because it works astonishingly in different situations or different clinical settings. I'll give you the example. For instance, at one place, when you inhibit the sodium potassium pump, it works to our advantage, inhibition of the sodium potassium pump. For example, heart failure. We give digitalis in heart failure. Digitalis binds to the pump, inhibits the pump, and that works to our advantage. That is, it increases the myocardial contractility. So it's given in the heart failure. So inhibition of the pump has worked to our benefit. But at some other place, inhibition of the sodium potassium pump has some hazardous consequences, and one such consequence is the topic for today's discussion, which is the penumbra in the CNS, where inhibition of the sodium potassium pump is causing an extension of the damage. So let's see what this penumbra is and how it's related to the sodium potassium pump. The basic concept that we are underlining is that all the secondary active transports are absolutely dependent on the primary active transports, and everywhere the primary active transport mostly is sodium potassium pump, and therefore we are essentially talking about the sodium potassium pump. So all the secondary active transports are absolutely dependent on the functioning of sodium potassium pump. If sodium potassium pump fails or stops functioning, all the secondary active transports will also stop functioning. And that its application is in this clinical condition called as penumbra in the CNS. So basically, penumbra is excitotoxicity to the brain. Excessive excitation in some areas of the brain, resulting in the damage to the nerve cells in that region. Let's first understand what is the dictionary meaning of penumbra. Basically, it has got different connotations or different meanings. But one meaning of penumbra in our normal language is that there is a dense core shadow at the center, and then there are lighter shadows at the periphery. As you move towards periphery, there are more and more shadows which are getting lighter and lighter. That's one meaning of penumbra. So extension of the original shadow to the peripheral parts, becoming a little lighter. The other meanings are there for the penumbra. For example, extension of the shadow seen in the eclipse. So umbra, penumbra, etc. But we can remember this as the meaning of penumbra, and it's what is the counterpart in medical field. Here in the CNS, the penumbra means extension of the damage beyond the original ischemic zone. Just like those shadows, one dense core shadow at the center and then the peripheral lighter shadows. So here in the brain, in medicine, penumbra would mean that there is an original ischemic zone, which is like a densely core shadow, and then the extension of that damage, the damage gets extended in the peripheral parts, in the neighboring regions. This extension of the damage is called as penumbra. Now, what's so special about it? Let's understand this. Let's say here is a blood vessel, and this is a representative diagram. Here is a blood vessel, and it is supplying this area of the brain. A representative diagram. Now, when this blood vessel is ruptured or blocked, that means blood supply to this much area will be blocked. And that means there will be ischemic necrosis and the cell death, which will be in this region, which was supplied by the blood vessel. But what we see is that later on, the damage extends in the neighboring regions as well. There is extension of the damage. And it's inexplicable because this blood vessel is ruptured. So blood flow is stopped to this area, and therefore damage should be limited to this area. But no, the damage gets extended beyond the original ischemic zone. And this extension of the damage is called as the penumbra, just like that extension of the shadows. Let's understand why it happens. What's the pathophysiology of penumbra? Now, first things first, you know there are glutaminergic synapses in the brain In fact, more than 90% excitatory transmission in the brain is because of the glutamate. Glutamate is the commonest excitatory transmitter in the brain. And how does glutamate work is by increasing the calcium influx in the postsynaptic neurons. You know that excitatory transmitters, either they will cause sodium influx, or in some cases they can increase the calcium influx in the postsynaptic neuron to cause depolarization of those neurons. So glutamate is known to increase the calcium influx in the postsynaptic neurons. And also to be understood is the fact that once glutamate is released and it has started acting on the neurons, postsynaptic neurons, then its action is terminated by reuptake in the presynaptic neuron. So glutamate reuptake occurs. That is how the action will be terminated. And now the most important part is glutamate reuptake is it occurs by secondary active transport, co-transport or symport. It is sodium dependent co-transport, or also called as sodium glutamate symport. So it's a secondary active transport, and therefore obviously it's going to depend on the sodium potassium pump working in that region in those neurons. We have already mentioned that all the secondary active transports are absolutely dependent on the sodium potassium pump. So let's see what happens in this particular clinical condition called penumbra. Let's say there is ischemia in some part of the brain. As we saw in the representative diagram, a particular blood vessel was ruptured and therefore a particular area became ischemic, and then followed by that the necrosis and cell death in that region. However, because of the ischemia and lack of blood flow, lack of oxygen supply, therefore lack of ATP production in that region, there will be failure of sodium potassium pump. We all know that the sodium potassium pump is an ATPase, and for this pump to continue to work, there has to be continuous ATP production. So if there is no ATP production now with ischemia, there will be failure of sodium potassium pump, and if the CHAMP sodium potassium pump fails, then of course the sodium glutamate symport also will not be possible. It's a secondary active transport. This will also not work. So here glutamate, once it is released, but it continues to act in the neighboring neurons. There is no reuptake mechanism which is working for glutamate. So it stays in the synapses, it diffuses into the neighboring regions, and it excites the nearby neurons. And excites the neighboring neurons, meaning it increases the calcium influx in those neurons. And we all know this, that calcium, if it is kept intracellularly, it is very damaging to the cell organelles. So therefore, increased influx of the calcium in the neighboring neurons or nearby neurons will result in their damage. So from the ischemic zone, original ischemic area, the damage has got extended in the neighboring regions, just like those shadows, one dense core shadow at the center and the peripheral lighter shadows. So similarly, the damage has got extended in the neighboring regions. In the nearby neurons, there is excessive calcium influx because of the and resulting in excessive excitation of those neurons, for which it is called as excitotoxicity to the brain. So isn't it astonishing that at one place we are inhibiting the sodium potassium pump and it works to our advantage. At some other place, sodium potassium pump is inhibited and it has hazardous consequences. Isn't the physiology very amazing and really astonishing? So to learn all such principles of physiology, why not subscribe to the channel?